Right. So we'll talk about another type of hypertension. Now, let me just break this down. Hypertension is high blood pressure. Now, high blood pressure could be that the cause is not known. That's what they call a primary hypertension. Hypertension could also be that it's as a result of another disease condition. That's what they call what a secondary hypertension. Now, it's not really it's not really that it must be a disease condition. It could be a medical condition. Now, pregnancy is one of those medical conditions that could actually cause what hypertension. That's what they call preeclampsia in pregnancy. If it is hypertension, that's high blood pressure and seizures, that's what they call eclampsia. Do you understand? So for the pregnancy induced one, we're basically trying to establish a link between pregnancy and hypertension. How can pregnancy be able to cause hypertension in women? So it's also known as gestational hypertension. It's a condition marked by high blood pressure. It develops around week 20 of pregnancy in women. And why we are saying this is a pregnancy hypertension is, look, this woman, before she was pregnant or before she reached this week 20 of pregnancy, they basically accessed her blood pressure and it was normal. Do you understand? All those antenatal care is good that you are measuring the blood pressure of the woman all along, so that when she hits week 20 or after week 20 and hypertension is coming in, they know that it was caused by the pregnancy. Also, key features, just like every hypertension, the systolic blood pressure is 140, diastolic is 90 millimeter mercury. All right, and you have done this on 2 separate occasions and it's the same. All right, no proteins in urine though. Okay, resolved after delivery. Okay, so is pregnancy-induced hypertension that moves to preeclampsia moves to eclampsia. In preeclampsia, you are having protein in urine. Okay, that's like pregnancy-induced hypertension that has not received attention, so it's now progressing. Potential complications: if left unmanaged, it can now progress to preeclampsia. Preeclampsia has protein. Okay, protein in urine, that's proteinuria. Okay, from preeclampsia it goes to eclampsia. The woman is having seizures. Okay, they have the HELP syndrome where you're having hemolysis, liver enzymes are elevated, low platelets. So this can pose serious risks to both the mother and the baby. Okay, so risk factors: what will make a woman have hypertension in pregnancy? It doesn't just come like that because not all women have it. Okay, so in which type of women is it more common? If she's pregnant for the first time, if the mother is under 20 years, or if the mother is over 40 years approaching menopause. Under 20 years, she's too young. Alright? Multiple gestations: if you are not carrying one human being, boys, twins, triplets, and the rest. Maybe there's a family history of this, so we might actually need your mother and your elder sisters to be in the consulting room, so that we'll ask them that, okay, when they were pregnant, did they have this issue? If the woman has other medical conditions underlying, like diabetes, kidney disease, alright. So monitoring and diagnosis is regular blood pressure checks, urinalysis to rule out the proteinuria, ultrasound to monitor fetal growth, blood test for liver, kidney function. So treatment and management is low sodium diet and hydration, frequent prenatal visits. You can give medications like labetalol, nifedipine if blood pressure is dangerously high.